Hey, Dr. Lindsey here. In this video, I'm going to discuss something that I don't think I've ever discussed in any video, and that is female type male pattern baldness in men. And so I don't see this very often in people except from the East, meaning from essentially Afghanistan through Pakistan, India, Burma, and Nepal. And we've had patients from all of those, meaning that they've actually come from there to the U.S. to get done. And I see that, and I haven't read anything about it in the books or the journals about why that is, but I would guess that probably maybe a fifth of patients from that region of the world that come here present with still a pretty good hairline and balding behind it. And I don't see that very often in your average North American or European Caucasian. But I saw it recently twice. And so I figured I would do this video to discuss this. So here's the classic Norwood scale of hair loss, going from 1 to 7. And I talk about this in a lot of videos. And this is your typical balding dude. Now here is the Ludwig classification for female type hair loss. And if you look, it's essentially a little bit of hair loss here, a medium amount of hair loss, or a whole lot. And that's Ludwig 1, 2, and 3 with preservation of the hairline. There's other causes of hair loss that are related to autoimmune diseases or scarring, or there's a variety of things. But as far as the typical hair loss that we see people come in for, men are in the Norwood scale and women are in the Ludwig. So when we see male patients with female type hair loss, it doesn't mean anything except you got female type hair loss. It doesn't mean your testosterone is low. It doesn't mean you have gender problems. It doesn't mean you need to eat more meat. There's no rhyme or reason for it. But I rarely see it in Caucasians, and I see it in maybe 1 in 5, 1 in 6 people from Pakistan, India, and Afghanistan, that area. So here's 2 examples. Here's a younger Indian man that still had a hairline, and we essentially did a big case starting about an inch behind his hairline and going until we ran out of hair. And he's a younger patient. I prepared him like I would prepare anybody for that. This front might go at some point, and so make sure you save some hair to deal with that in case you need to, because the hairline we worked on was too high. But there's no point in putting hair where he has good hair. It might not ever go away. So here he is at the end of the case, and you'll note that we shaved his head, and so you just see where the grafts are. And then here he is at 7 months, and because he's got dark skin and dark hair that's probably 2/3 growing, it already looks like he's got a near final result, but it's 2/3 growing. It'll get better with time. Now here's a Caucasian fellow with the same thing. Notice he's still got a good hairline, but he's bald all through here, and so we did a big case on him, starting behind his hairline and going until we ran out of hair. And I think he's a mid-30s fellow, and so again, he might lose this and need to deal with it, but here he is the last time I saw him at 23 months out from getting this procedure done. And the whole top of his head's covered. He's still got a little bald spot in the back, which we might deal with, and his hairline is unchanged. So in summary, I do not know why people have different types of hair loss. And in general, if you're a man in the United States of any ethnic descent looking at this, you're probably in the Norwood scale. And we typically either do the crown, or we start at the front and work our way back, or just do a woolly in the front. And if you're a woman here in the United States, we would typically be looking at the Ludwig scale. But if you're looking at this and you have a good hairline and you're thin, not back at your crown, but in just behind your hairline, maybe this video is of particular importance to you. And when you come in, we'll talk specifically about fixing the area that's the problem, but saving some hair in case that front goes away. If we can help you, please give us a call. Thank you.